Thank you so much for having me. I think this is a great opportunity also for cooperation between our two universities. I've been now for almost 5 years with NYU Abu Dhabi in the capacity of clinical psychologist, senior counselor, counseling team leader at the health center at NYU AD. That means I'm not teaching, I'm actually providing support therapy for our students. Obviously, you know, as it has been pointed out already, this is such an important and timely topic, talking about mental health at this time. I just, you know, appreciate everybody who joined. I know we are all probably, you know, a little bit fed up with Zoom and just being on the screen constantly. So I always appreciate extra effort people make to attend things. I hope I can make it engaging and interesting. The plan is to talk a little bit about what I think is interesting and kind of to the point and useful at the moment when it comes to mental health and COVID pandemic. And then just to take questions if you have any. We have plenty of time. I have only a few slides to share just to make it easier to follow and to stay on the topic. So again, welcome everybody and thank you so much for having me. So I will start to share my screen to kick it off. Here we go, yes. And so, just to dive into the topic immediately, we are in a very interesting situation for 9 months now, worldwide pandemic. We all know a lot about it. And I just wanted to kind of capture and summarize the current challenges we are facing now that we are 9 months in to this situation. So it's not the very beginning, it's also not the end yet, unfortunately. So we kind of moved from an emergency emergency situation into prolonged crisis. That means still it's very heavy in terms of coping with it. It's very demanding still, and it's just longer than a crisis. We all know that the good thing about crisis is that it can get really, really bad, but it's always limited in time. So now we're facing a longer challenge. There's a danger of second wave, obviously. It's going around the world. UAE is fantastic in managing, obviously, you know, the pandemic and really sticking to all the preventative measures. But, you know, we're all watching the news. There's that ongoing anxiety that we're all feeling about what's going to happen next. Are we going up? Are we going down? And also, you know, just thinking about, you know, for us who are expats, and not just for expats, just thinking about the rest of the world and how, you know, our families, friends are affected. What does this mean for us, for our lives at the moment? Again, like I said just previously, just now, you know, we're all a bit tired from, you know, doing everything remotely or differently than usual. So there's pandemic fatigue, you know, paying attention to so many things all the time, staying safe is very important. It's also tiring and draining. There's also decision-making fatigue. And when I say that, I think there's so many things that fall under or into that category, which is, you know, just taking decision on a daily basis, decisions about, you know, do I leave the house? Do I stay in? What do I pay attention to today? What are my priorities? For those of us who have children, you're deciding for them, are they going back to school or not? Am I going to allow this or not? You know, paying attention to, are they being careful, taking a decision. Now it's winter holiday season coming up. You know, are we traveling? Are we staying? What's going on? How are we going to spend the time? Because these decisions are no longer so harmless, and you know they're kind of all very big decisions all of a sudden, and very with far-reaching consequences. So we're all a little bit tired of that, like constantly having to decide about so many things. And then obviously managing the ongoing uncertainty, which is basically the worst possible thing you can do to a human being, because we are equipped for so many things. We are very resilient. But when it comes to uncertainty, there's something missing in our mental system. You know, we just like certainty. We just like to hold on to things, and we just like to know what's going to happen, even if it's bad. And so that's the biggest challenge of them all currently. Okay, so now looking back at the beginning of the pandemic here, or in you know, most parts of the world. So what is different now compared to February, 9 months ago? You know, good stuff. Vaccine is soon available. You know, 2 vaccines that are claiming to be very efficient. So that's fantastic news. But there's vaccine, and then there's vaccination, as they say. You know, how will it be rolled out? There's much more knowledge about the virus. Not everything, of course. There's still a lot that we don't know, and we are finding out through science. But there's a lot more knowledge than in February, and it's still a big nemesis, but we know a lot more about that nemesis and how it spreads, and how can we actually try to slow it down or keep it contained as much as possible. There's a lot of familiarity now with preventative public health and safety measures, so it's not so weird anymore that we have to put masks on, wash hands, wear gloves, whatever it is, wherever you are. And what also happened in the meantime, which is very good, you know, that the partial return to work and school was enabled, especially here in UAE, and we are so grateful. I have 2 children. One of them is back in school. The other one isn't, because, you know, they are just in different years. But, you know, as of January, everybody goes back to school, hopefully. So, you know, we had that sort of like partial return to some normalcy, but again, it's kind of a new normal more than going back to any old normal, if that ever comes back to us. So there's a lot of there are a lot of developments that are reducing some of that uncertainty that I spoke about. That's so challenging, but there's still some ongoing, you know, questions that are unanswered, and also, you know, we have to see what happens next. So that portion of uncertainty continues. So when it comes to managing ongoing uncertainty, so it's not the one that is time limited. It's like, okay, so this is what life is all about right now. We have to kind of adjust to the situation. It remains challenging. So first we have to look at our own personal, each of us, tolerance for uncertainty. And we're all different people with different life experiences at different stages in life, and so we have our ways how we deal with uncertainty normally, and this one is just added layer, and so for some of us we have higher, and for some of us we have lower tolerance for uncertainty. But it's really good to look into that and reevaluate that. Maybe now 9 months in, has the needle moved? Am I a little bit more tolerant for uncertainty, or did I become even more rigid and more anxious about it? Just like very, very low tolerance for uncertainty, maybe as a consequence. And of course, connected to that, we all have to know and recognize and also respect our own limits. And again, they're very individual, and they're personal limits. And personal limits means, you know, how much work can I take on like this? How much can I, you know, how well can I take care of my children at this time, or parents, or stay in touch with friends, or be in touch with anybody? Can I do it constantly, or do I need some solitude to recover and restore? So we all have to evaluate all of that almost on a daily basis. I would say not almost, but on a daily basis, just to, you know, kind of check in. Oh, what are my personal limits today? What do I need to be careful about today so that I actually can keep going? What's helpful with that is setting priorities, right? We're always more stretchable for things that are more of a priority, and we can have professional priorities, we can have personal priorities, you know, all kind of in parallel tracks. And sometimes they impose themselves, but sometimes we have more liberty to decide what is important at this time, or at the moment, or today. What's really important is to maintain emotional bonds, because that's kind of the antidote for uncertainty. Because emotional bonds, the ties that we have with people, especially with family and people who are close to us, friends, family, whoever is close to you, they give us that abstract but still tangible certainty, even in uncertain times. So that's why we hold on to that. And, I think especially in the beginning of the pandemic, we were all so much more willing and diligent with staying in touch, and maybe that got lost somewhere, but kind of revisiting that and just making sure that we are in touch and that we are still fostering those relationships, because they do help us with managing uncertainty and with reducing some of that anxiety we're constantly feeling. And here I also have listed radical self-care. I know it sounds a bit weird, radical, like what is good about radical? Nothing. But sometimes, what we mean by that in psychology, it's kind of, you really have to be serious about it. That's why we call it radical. What's required is more intentional self-care, not like, as it used to be before, on the weekend when I'm done with everything, with all the chores, and then when I get time, I will then take care of myself. No. Now it has to be, because it's part of, maintaining good mental health and mental fitness, is actually to pay attention to self-care every day in some way. And I'm not talking about taking 2 hours, long bubble bath, but I'm talking about maybe just 5 minutes to breathe intentionally, just like not being available to take care of everybody and everyone, like just for a few minutes per day, just taking that time for ourselves. That's also self-care. There are very small acts of self-care that also count. Radical just means being much more strict about that and maintaining that, like some sort of mental hygiene, and not just occasionally, or where we have to make time. We can't just wait for time to appear for it. Just like that, radical acceptance, again, radical, like serious acceptance of our circumstances is required, because otherwise we will not be able to adjust. So things that we cannot change, obviously we have to accept in some way. I wanted also just to share, and maybe some of you have heard or used this model before. It's Control, Influence, Accept model, or in acronym CIA model. It's kind of catchy and easy to remember. Why did I want to bring it up? It's because I thought that for these times, it's exceptionally useful. It might seem very simplistic, but it's also very efficient. Especially in this whole, ocean of uncertainty we are dealing with, and our need to control things, especially as adults. We want to be able to be in charge, but there's not much we're currently in charge of. So we're all kind of floating in that pool of, we need to accept things as they are. But this model is originally a stress management model, and it's less clinical and more kind of from performance coaching world. Really, just a good model to manage any stress at workplace, but also in private life. So what this model tells us is that we can look at any situation, any challenge we are facing, decision we are making, any conflict we have to resolve, kind of through these 3 dimensions. And you can even imagine, and it's kind of presented on the chart as circles, and you can even imagine there's like more of a circle, each one of them like concentric circles, right? So we start with the smallest one, which is the circle of control. So that dimension is, the one that we love the most, but it's always the smallest in any situation, or most of the situations. So there's only a few things we can fully control. They really fully 100% depend only on us individually. So we have to first identify what in this situation is within my control. So if you look at the pandemic, what's within my control completely is how I actually pay attention to safety measures, how I take care of myself. I can't control other people's behavior, but I can certainly control mine. So I'm going to wear the mask. I'm going to stay away from people. I'm going to behave in a way that is recommended, right? So that's definitely within our control for each one of us. And then there's a bit of a bigger circle, which is, circle of influence. Now we're losing 100% control, but we have some sort of influence on the situation, right? So we can, with our behavior, with our tone, with the way we approach the situation, de-escalate it or escalate it, right? So this is where we also can decide a little bit how we communicate with others, how, if we see somebody who is, not wearing a mask, are we going to shout at them, or are we just going to, politely point it out, or just say something that will not escalate the situation, but will bring a solution? So still we have some control, but we are more into the influencing the situation because it doesn't depend fully on us. Same as, dealing with our family members at home, just explaining to them why we are not available, or why this needs to be done that way. Why are we not traveling? Why can't they leave the house right now? So stuff like that, where we need cooperation from others. And then the biggest one, the ocean, is the ocean of acceptance, right? Which, is the hardest part. There we don't have control, nor we have any influence. It's just plain and simple acceptance. Acceptance, however, doesn't mean approval. So we don't have to be approving of the fact that there's a pandemic and deadly virus around. Of course, nobody likes that. We are not approving at all, but we need to accept the danger. We need to accept the fact that it's not over yet. We have to accept that there are rules we all have to adhere to. We have to accept that maybe, we can't do certain things at this time, no matter what. But we don't just accept and passively kind of sit there and are miserable. We also need to adapt. So there's also a little bit of that control that comes in again. So we have to adapt and manage that whole situation that is just, if you want, dumped on us, and we have to deal with it. But we are going to deal with it in a way that is not just, surrender, but kind of like, how can I adjust and manage the situation in the least damaging way for myself and for others. So I hope this makes sense. I find it personally very helpful. I apply this all the time. There's a lot of challenges every day. I struggle with acceptance myself, obviously. I like to, make things happen. I'm not extremely patient person, or not at all. So patience is not my virtue. I might think it's overrated sometimes anyways, but like I struggle with that obviously because it requires patience, but I also do understand that it's the only way to get through the situation, and that kind of helps me adapt and adjust and do things and not be, and this is the trick and this is the trap. Many times we are in the field, in the ocean of acceptance, but trying to control things, and that's where the frustration comes from. So we should not mix these up. So if we are supposed to accept something, but we are trying to control it, we will eventually end up frustrated, maybe even depressed, right? Out of just not being able to do it. But if we just recognize that, no, this part I need to accept, but this little thing I can control, and then focus on that part, that can reduce the frustration. So I think that the message is control the controllables, right? Just to focus on what we can hold on to, and instead of just holding on to something that's completely out of our control. And this is basically my last slide that I had prepared, and then we can open the discussion. So I think the building on acceptance part. We all have to accept that this is the pandemic, the COVID-19 is a marathon that we are all running, regardless of our preferences. If we are a sprinter, that's amazing, but it's not 100 meters, it's many, many kilometers. And we hope we are, in like close to the finish line, but we don't know yet. It's not yet in sight completely. So what helps us when it comes to a marathon? I kind of listed 3 things that I believe help with, any strenuous kind of exercise, or like where actually a lot of energy for a long time is required. So we have to all pace ourselves. And I think it's so important. I think we're all very much, especially professionals and especially at university, we all work with deadlines. It has to be quick. It has to be done. There's a flow. There's academic year. It's flowing. There's no time to stop. What are you talking about? But we all have to like take it a notch down, a little bit slower, just to last longer, right? Endurance also, part of it is, don't speed it up. Don't waste all of your energy in the beginning. You have to make it last. But you have to continue, right? Like there's not much value in giving up, we also don't have a choice. So kind of finding that strength to continue, to go on, to, even if we dislike it even a lot more than in February or March or June, but still like, okay, we're not done yet. I still have to, continue doing these things. And I think, I was thinking about putting hope here, but then I opted for determination, because I think, hope, obviously we all have it. And there's a lot of justification for the hope, because vaccines are, at our doorstep, and, stuff will get done and it will be better, hopefully in a few months' time. But I think we have to be determined to get there as well. Hoping alone is not enough. I think we actively have to contribute by just staying on track, just not derailing, just, keeping the eyes on the prize, so to speak, and just to be determined and kind of pull those last sort of molecules of energy together to continue. And, keep refilling those cups, right? Like you can't pour from an empty cup. And I think it's the end of the year. It's such a weird year. We all want it to be over, I guess. But, we have to keep refilling that cup just a little bit to continue, because you can't afford to be completely empty. So, it's like, just like with the phone, right? Like it's almost dead, but then you recharge it for 2 minutes, it can still continue. So I think we're all at that stage right now. Let's be realistic. It can be wonderful, but just enough to go on, and just to kind of keep paying attention to energy levels, and just, thinking of exactly this, that it's a marathon, it's not a sprint. Maybe it's a good thing to just slow down a little bit more, because that gives you more time to breathe and to kind of calm down, and then be able to continue a little bit better, a little bit more, a little bit longer, till we really all get to that finish line together. So these were all my slides.